this presentation, we will briefly explore the different types of pain and what happens in the nervous system when we experience pain. The learning objectives for this presentation are to review the definition of pain and review different ways that pain is classified. The International Association for the Study of Pain defines pain as an unpleasant sensory and emotional experience associated with actual or potential tissue damage or described in terms of such damage. Although pain is a common experience, it is difficult to define and describe. In part, this is because it's an internal and subjective experience, but also because there are different types of pain. We sometimes describe pain in terms of how long the person has had it. We use words like acute pain to describe new or brief pain, and chronic pain to describe pain that has persisted for an unexpected length of time. Additional terms such as subacute and episodic are used to describe pain that doesn't neatly fit into either the acute or chronic category. These terms are common and can be helpful. However, it's important to keep in mind that the timelines used are somewhat arbitrary. They are loosely based on stages of tissue healing and the assumption that most damaged tissue will heal within approximately 6 months. Regardless of how long pain has persisted, it can be complex. Both acute and chronic pain are influenced by biological, psychological, social, and environmental factors, which can be challenging to unravel and manage. Another way to classify pain is based on its underlying mechanisms. The two main types or classifications of pain are nociceptive and neuropathic pain. Nociceptive pain occurs when there is injury, disease, or infection in the tissues of the body, such as muscles, bones, joints, or organs. If pain arises from an injury or infection to a nerve, it is called neuropathic pain. Nociceptive pain can be further classified as either somatic or visceral based on which tissues are affected. If one of the visceral organs is affected, such as pain arising from a heart attack, it is called visceral pain. Neuropathic pain can be classified as either peripheral or central, depending on whether the affected nerve is part of the peripheral nervous system or central nervous system, which includes the spinal cord, brainstem, and brain. These classifications don't cover all types of pain. They don't explain pain that persists after tissue healing is complete, or pain that arises for no apparent reason. A third classification is pain amplification. Changes in the function and structure of the peripheral or central nervous system can create sensitization that allows pain to persist even after an injury or disease has healed. Central sensitization may explain why painful conditions sometimes arise when there isn't an identifiable injury or disease to explain the pain. Changes in the sensitivity of the nervous system may also explain why pain sometimes appears to be out of proportion to what would be expected with the findings on clinical exam. These categories are not mutually exclusive. Many conditions can involve nociceptive and neuropathic pain, or a combination of all three classifications. For example, someone that has low back pain that radiates down the leg to the foot may have nociceptive pain arising from the tissues of the low back, neuropathic pain from an injury to a nerve that causes the pain down the leg, but the person may also develop pain amplification that maintains pain even if the original injury heals. Under normal circumstances, nociceptive pain occurs when there is a mechanical, chemical, or thermal stimulus strong enough to activate receptors and special nerves called nociceptors. Signals travel along peripheral nociceptive nerves to the spinal cord. Information from these nerves can be altered at the spinal cord, brainstem, and brain. Basically, the central nervous system integrates all of the information it is receiving or has stored, other sensory information, as well as emotions, worries, and memories of past experiences. This information is processed and may result in pain or changes in behaviors, as well as emotional and hormonal responses that help the individual escape from harm, seek relief, or behave in ways that aid recovery. Pain amplification changes the ways in which nociceptive and non-nociceptive information are processed, meaning that pain can be present or exaggerated even if there is little or no new nociceptive information. It is more effective to base treatment choices on the underlying mechanisms of pain, rather than how long pain has persisted. Important treatments could be missed. Different classes of medications are selectively effective for nociceptive or neuropathic pain. So it's important to determine if neuropathic or pain amplification is present in order to apply appropriate treatments. To summarize, there are different types of pain. Pain can be classified based on the underlying mechanism. There are two main types of pain, nociceptive and neuropathic, with an additional category called pain amplification. An individual can have one or more of these types of pain occurring at the same time. Pain is the unpleasant experience that occurs because of activity in the spinal cord and brain. But pain is not the same as nociception, which is the term to describe activity in special nerves that transmit information about tissue damage.